Hey guys, this comment was left on an older video of mine where I was talking about fat grafting versus breast implants. And this person mentions the risk of breast implant illness. And this is a video I have not done before, talking about what exactly is the risk. How many women get breast implant illness? The short answer is we don't know. And that's because breast implant illness is a diagnosis of exclusion. So there's not any diagnostic criteria, like if you have XYZ symptoms, then you have breast implant illness. And there's no test for it. Basically, people who report symptoms, and they're all very non-specific symptoms like brain fog, fatigue, thinning hair. And by non-specific, I mean that they could be due to lots of different things. People who have those symptoms, basically we do a workup, look for any underlying hormonal, autoimmune causes, and if we can't find anything else to treat, then we might remove the breast implants, depending on the patient's preference, obviously. If the patient prefers that, we can remove the breast implants and see if it helps. So it's kind of a tough thing to pin down, and there have been studies looking at breast implant illness just to see if there's any clear consistency in terms of symptoms or physical exam findings. And unfortunately, there really aren't. There aren't any lab tests that are consistently abnormal. There aren't any symptoms that are consistent among everyone. The only consistent finding between people with breast implant illness is that they tend to get a lot of their medical information from social media. And I don't really know what that means. It does mean there's not like an underlying physical cause in terms of, oh, it's heavy metals, or, oh, it's an infection from fungus. Could it just be an overabundant immune reaction to a foreign body? Maybe. We don't really know. What I can tell you is that if you have symptoms that you might worry are linked to having breast implants, then we do a workup. We look for other causes. If we don't find those causes, then taking the implants out may help your symptoms improve. And in terms of taking the implants out, whether or not we remove some or all of the capsule doesn't seem to affect that improvement in symptoms. So if you leave the capsule in place versus remove part of it versus doing a total capsulectomy, improvement in symptoms seems to be the same. And that's really all we know. But since there's not clear diagnostic criteria, I can't give you risk factors because I don't know how many women have it out of how many women have had implants. So it's kind of tough to give a risk on that. And this is basically the conversation I have with all of my patients who are considering breast augmentation.